not moved over like we did before, okay?
Okay. No, can I just use the regular restroom?
I want to see because
he could take me in a wheelchair.
I want to check with our nurse first because we're obviously worried about what happened earlier happening again because we don't want that happening again.
Right.
That would suck and it'd probably make you feel woozy. So let me see, okay?
Yeah, I don't feel woozy anymore.
So what's going on?
I don't want to do the blood draw. I think I want to go to. I think I want to get a second opinion from like a different doctor.
Why? But you're gonna get it. Why don't you want to? Why don't you trust what I'm telling you?
I just want a second opinion. I'm not ready to do surgery.
You realize you could lose the function of that hand without surgery, and it needs to happen soon.
No, I'm definitely gonna take care of it soon.
You're not gonna find another hospital with a hand surgeon.
What are you talking about?
We're the only hospital in the area with a hand surgeon.
Well, then I will go back to San Diego.
You can't wait that long. You're gonna lose the function of this hand.
What do you mean that long? 9 hours?
Yeah, it needs to be fixed. And you also have glass in there that needs to be taken out.
So, I mean, why isn't the glass been taken out then?
Because it's going to happen in the operating room. I'm not gonna just do that. That needs to happen when they can locate it.
But me just sitting here, like that's taking time. I could be on my way to San Diego. Because that's where my insurance is at.
Okay, I really don't think you should leave the hospital. I really think you need to have this addressed.
Yeah, no, I just want a second opinion, and I just want to.
Is the hand surgeon's opinion not good enough? I mean, that's the specialist. That's who's going to see.
Yeah, absolutely.
No, it's not that. Like I would like to hear his opinion, but I want to hear it from like second person as well.
Well, yeah, that would be me and another person.
But like from a different like a hospital. I just
Do you understand that by leaving and not doing surgery, you could lose the function of your arm, and you could never regain it, and you could never use that hand again?
Well, I'm gonna go to the hospital as soon as I leave.
Okay, but even by leaving and going to eat, you run the risk of getting infected. Because I'm not going to suture it closed. I'm not going to close the skin.
I understand that.
And it could also start bleeding again, and you could have a big bleed and die.
I'm going to the hospital right after.
In San Diego, 9 hours away.
I mean, but if something happens before that, then I'm gonna go to whatever I have to, just to make sure that I'm okay. Like, I don't want to, like, it to get worse. But like, my plan is to go to San Diego. But if I have to, like, stop at a different hospital,
you want to sign out against medical advice and leave the hospital because you're gonna sign out against medical advice and leave the hospital.
Yeah, I guess.
And you run the risk of losing your arm and hand.
I mean, I'm not gonna let myself lose my hand.
But if it bleeds in the way and you lose the blood flow to that hand,
I'm gonna stop it.
But it could take another 5 or 6 hours to get you where you are now, because you have to go through the ER again. You have to be seen. You have to get the surgeon on board. I already have the surgeon on board and everything ready to go. You're gonna have to have another IV placed. You're gonna have to do all that again.
That's fine. I just feel really uneasy about the surgery. And I want to hear from, I just want a second opinion.
Hi, Dr. This is Dr. McDaniel, our psychiatrist. Let me just talk to her real quick.
Thanks.
Absolutely, thank you.
Yeah. I don't care. If you want to. Okay. Carissa.
Hi.
Hey, I'm Dr. McDaniel. How are you feeling right now?
I'm good. I just,
Are you comfortable?
Look at the stool in here.
I'm a little bit comfortable. I'm as comfortable as I'm gonna get for now.
Okay, is it painful?
Not as much.
Okay, good.
The stick in my arm, it's really hard to move my
What's
arm.
bothering you here? What's bothering you right now? This?
Stick, yeah.
Or
No,
this?
no,
Is it
the
this?
Stick, yeah.
Okay, let me put a pillow under here.
Oh, that's not gonna help.
Yeah, what, really? Okay.
Yeah, it's just
okay.
I'm trying to like move around and it's really hard to.
Right, it is. Yeah, okay. So do you feel like you understand what's going on?
Yeah, I understand. I want a second opinion, and this is not where my Medi-Cal is located.
Uh-huh.
So
Are you worried that your insurance isn't going to cover?
no, it's not that. I'd like a second opinion, and
On what part of it, huh?
just on the surgery and stuff, and I have a doctor that I'm a little closer to, but I just feel like I'd like a second opinion. And
Do you want to talk to that doctor on the phone?
well, they would have to look at it, I think.
Where are they working?
They're just over there.
Oh, okay. Is that, where
That's
do you
where
live?
that's right.
Oh, you live in San Diego?
Yeah, I'm just living in right now. I was in the process of relocating, but my job.
Okay. Oh.
Oh my.
Oh, yeah.
Oh,
So how long have you been in
Thank you.
Seaside?
Just like a couple of months on and off.
Okay, and do you have people here, like family?
Just for me.
Okay, how's that going?
It's cool.
It's cool?
Yeah.
Okay, and what do you do? Do you work? Are you in school?
I do online marketing and e-commerce.
Okay.
I'm planning on going back to school, but
Okay. Do you have any income right now?
yeah, from the online marketing and e-commerce.
Okay. Okay, and do you have any family support?
In San Diego, yeah.
Okay. All right, so you're planning to go back and live where?
I'll probably live with my grandma.
And have you ever had any mental health treatment in the past?
No.
No? Okay. Have you ever had any drug or rehab, anything, drug or alcohol? Do you use any drugs or alcohol?
Not like regularly.
Okay. And what about recently?
I think recently, like in the last week, yeah.
Okay, I'm not judging you or
Yeah.
anything, honey. I just want to know which one.
I'd rather not talk about it. I'm not really proud of my choices.
Okay.
Yeah.
We're just looking at your tox screen that shows some methamphetamine.
Right, yeah.
Do you smoke it?
No.
Or how do you take it?
I just did like a bump
How does that?
in my nose.
Oh, okay. Thank you. And how often have you done that, or how many times total?
I just did it with like on a social thing, like this week.
So just this week,
Yeah.
for the first time?
No, not the first time, but it was just like a social thing.
Okay, so it's an occasional?
Yeah.
thing? Okay.
I'm not proud of it though. I'm
No,
not.
it's okay. You know, do you want rehab for that?
No, I don't have an issue. It's more of a social thing.
Okay. Okay.
Not necessarily a good decision, but it was more of a social thing than a.
Now, what happened with your hand today? Like, what happened?
So I was making these donuts, and my friend, like I told him like, hey, you want some? And he got up, and he was watching me stir them in the glaze, and I was trying to get by him, and he always does this. He always like stands there, and he sees that I'm trying to get by, and he just stands there, so I have to like push my way through.
That's
And
annoying.
it's just really frustrating, and so I like try to push my way through, and I dropped the donuts. And I got so mad because I had just like worked so hard, you know.
Yeah.
It was very frustrating, and
Okay.
I just like
I'm gonna put this behind your head.
threw a fit.
Yeah,
Yeah, a little bit. And then I hit a glass thing, and I didn't think it was gonna break. I thought it was way thicker than that, but
Okay.
I definitely didn't plan on
Okay.
getting hurt like that.
Okay.
You
You
know.
weren't trying to hurt yourself.
No, I was like darn it, like, and I like hit it, and
Okay.
it broke, and
Okay.
it was not
Alright.
expected.
Okay. Now, has anything like that ever happened before?
No.
Okay. All right. Have you ever been aggressive?
No. I don't want to
Thank you.
myself.
Thank you. All right. And okay. No history of cutting yourself or
No.
anything. Okay. Okay. Thank you. We just have to go through it.
Yeah.
You know? So now, what did the doctor tell you about what the injury is and what they want to do?
Well, you said that there's glass in there, and like I'm not like I definitely want to get the glass out, but I don't necessarily want to like do surgery yet. Cause like I want to see like my options kind of and like what I just want to get a second opinion of what just from two different people from two different hospitals.
Yeah. Is there, and do you know what else they want to do in the surgery besides?
Not exactly yet.
Okay,
I don't know yet.
okay. And so did they tell you that one of the nerves is injured, the ulnar nerve? Did they tell you
They
what
didn't tell
that?
me which nerve, but they said that it's a possibility. But like,
Okay.
I'm not gonna like if something happens, if I leave, if something happens, I'm definitely gonna go back to hospital, whether it's
Yeah.
where I plan to go or if I have to go
Okay.
sooner.
Okay.
Like I definitely don't want to get hurt more,
Okay.
but
So what is it, and you can, I'm really curious and also concerned about you, right? But what is it that makes you unsure here? Like, is it something about the doctor? Is it, what is it?
it's just I'm not from here, and I'm just kind of like I don't know. It makes me nervous, and I'm not really like I know I have a better relationship with the people at the hospital, and I'm just familiar with it, and I'm just like really far from my family and stuff, and I just feel really
Okay. You want to call them or anything?
I don't really think that would make me feel better. I just have to get closer, and then
Okay. All right. Did they tell you what the urgency is in the sense of like how important is it to do it now versus in a week, for example?
well, I feel like they said that it's urgent, but like they haven't actually looked through it yet. They looked at it,
Okay.
so like
Okay.
I mean I'm open to hear what their
Okay.
opinions. But,
Good.
yeah.
And it is your choice. Okay. I want to say that let's have them come back and talk to you about the specific nerve, because if it's a nerve that needs to be repaired, you don't want to lose function. Are you right-handed?
Yeah.
Okay, we don't want you to lose function in that hand, right? Now, would it be the surgeon that's doing it in the OR if it was here? Where would it be? Do you know who would be doing it?
Where in San Diego?
No, if it was done here.
He said that it's surgeon.
A surgeon.
I'm not totally sure.
Okay, probably surgeon. Okay, all right. So, do you have any person, like family or doctor, that you would like us to speak with, or that with you, or that you speak with alone?
I have a doctor that I could contact, but they're not. I don't think that they do hand stuff.
But just to
But they are
discuss what's
knowledgeable.
going
Yeah.
on, and then if you want, they could talk with the doctor here, and then talk with you again and tell you if they're comfortable with
Yeah, I'm
the
gonna
plan.
reach out to them for sure.
Okay, do you want to consider that?
Yeah, I'm
Because I just don't want you to lose it to right hand.
Yeah, no, definitely. I'm not gonna take that. Like, I'm not gonna let that happen.
If it was me, and this is just me.
Yeah.
Okay, and this is true. If it was me, I would trust the specialist here.
Yeah.
Because they are really good. Okay, just for.
I'm just so nervous and like
I
I've never
know.
had a surgery or anything.
Okay,
I've never
but
been
we
personal
can
one.
give you anti-anxiety med if you want, like
It's not
Ativan.
bad. I just
I know it's hard. It's hard, and it's hard if you feel alone
yeah.
to make a big decision. So that's why we want to pull in anybody that you feel comfortable with, that you want to talk to, or that you want those people to talk with the doctors here, and then find out if people are comfortable with the plan, then maybe you'd be more comfortable. And I just don't want you to have any long-lasting effects of this.
Yeah. And then my dog is home alone
What
too.
kind of dog?
It's American Stafford and Pug
Oh.
mix.
Okay, would your
Yeah.
roommates take care of them?
Yeah, but I don't know. Like he's like I don't know. He's a nice
Okay.
person, but sometimes he's kind of harsh on him.
Okay.
So I haven't really
Yeah,
left him
I
alone
understand.
like that.
I'm the same way with my dogs. They're like my babies. But listen, one of the things to put in the forefront of this is we don't want you to lose function of your right arm.
Mhm.
And the nerves do control the motor, the muscles. Nerves
Mhm.
control the muscles. So let me have them come back in and talk to you about the nerve injury. And then if there's anybody that you want the doctor to speak with, I'm sure that they would do that, okay? All right. So
You work for the psych, right? Like the psych.
I'm psychiatry in the medical side.
Is
Yeah.
there any way that I can get my dog to come before I do the other stuff, just
You mean
for
before surgery?
yeah, for mental
Oh,
health?
is he like an emotional
Yeah.
support animal? Let me find out.
Okay.
Okay. Find out. I'm the same room with my dog.
Yeah, and I feel more at ease, like, you know,
I
it's just,
know,
he's
they're
not
so
used to being
comforting.
far from me, and I know he's like freaking out right now.
Okay, but you know what? He'll freak out more if your right hand doesn't work.
Yeah.
Do you know what I mean?
Yeah.
So let's also think longer term, because I just, you know,
But
I
it'll
want
put
you
me
to
at
be
ease too,
okay.
you know.
Yeah, I understand. I get that. All right, sweetie. Whoops. Right now.
Sorry, I spilled
Don't worry about it at all.
that.
Right now, do you want anything like right now, like the for anxiety, like a little bit of Xanax or anything?
No, I
Okay.
don't
Okay.
know if I want to be
That's
asleep
fine.
right now.
That's no. It won't.
They did the they gave me stuff for nausea because I could feel like my heart pumping through my wrist. It's like kind of strange.
Right, and
And
that has to be repaired.
yeah, that helped with the nausea. And then they numbed my hands for the most part, so that
Okay.
helped. I don't really want like pain or anything like that.
Okay.
Even though I am in pain, I can deal with it.
Okay. Okay. Do you feel like anybody here might want to hurt you?
No, I'm just under pressure, and I don't know, I just miss my dog.
Yeah. Okay.
I kind of have like social anxiety a little bit, so.
Yeah. Okay. That's okay. That's okay. And we're here to support you.
Okay.
That's why whatever you feel like you need to feel comfortable, you know, we want to try to do that. Okay.
Okay.
All right. All right. So let me talk to the doctor. Okay.
Okay.
All right. Hon.
Thank you.
Thank you.
Okay, Krista,
Yeah.
hi.
Hey.
So this just tells you why you were placed on the psychiatric hold, and when it started, and kind of the patient's rights number, your rights, things like that. So, but you just talked with the psychiatrist, Leslie.
So I'm not on the hold anymore.
You are right now. She has to cancel it. I haven't talked with her yet, if she's going to.
Okay.
So, but I'll leave this.
I'll take that.
Okay. I'm not sure where. Okay. And I know you told me you weren't suicidal, but there was concern about that originally.
Yeah, no, I definitely didn't
I
plan on the
know.
glass breaking.
I know, but I'm just letting you know, even though
Yeah.
those are the reasons, I know that we just needed time to fully evaluate.
Yeah,
That's
no
what it is.
problem.
Okay.
Carissa, I'm
Yeah.
just breaking mystery,
Okay.
and then when she gets back, she's just on a break.
Okay, thank
So if need
you.
anything.
Alright, thank you. Do you know if my friend left?
I'm not sure.
Yeah.
Maybe he's out in the waiting
No
room.
problem at all.
Okay, Christina.
Yeah.
I'm sorry, Carissa.
Yeah.
That's a pretty name.
It's okay.
Okay, so I spoke to the Dr. Smith, the ear doctor, and what he said, so the ulnar nerve, it may, since there's pulsing, it may have hit the ulnar artery, and that can be repaired. And so the ulnar nerve, which may be also hit, controls being able to do this and being able to flex your wrist.
Okay.
So it is really important for writing, for holding things, that the ulnar nerve and artery get repaired. And because there's potentially it seems like there's some glass in there,
Yeah.
that causes a risk for infection, which means you could lose your hand.
Right.
So what I would say if it was me is I would have the ear doctor's happy to talk with whoever, and then you could again talk privately with that person to find out if they're comfortable with the plan. We just want you to, it's
So,
your decision.
Do you think that like another option would be to like of course I want to get the glass out because like that's kind of like
yes,
that's definitely like important.
yes.
You know what I'm saying? But like maybe like the other parts like could be like questionable. You know what I'm saying? Like
I don't. Well, okay. If your ulnar nerve is cut or damaged, that can be repaired, and the sooner it's done, the better it will heal.
but is there different techniques to repair it? Like I want to do like
That would be
research.
they're going to get. So what they will do is they'll get a hand surgeon.
Okay, yeah.
They will get a hand surgeon. That's all they do.
Okay.
And they have that here, and they're going to get somebody that is really experienced with dealing with these nerves that go to the hand.
Mhm.
I personally, if you're my daughter, I would trust them and I would let them do it. But that is your decision. But I think that they're very, very good. I really think you're in really good hands. Okay.
What was I gonna say?
It's scary.
Yeah.
But, we can help you with that part of it too. So that you don't feel so angry. Partly it's the methamphetamine that makes you more anxious. Because
Well,
it
I
makes
haven't
it-
had any in a like a while, like at least like several hours.
Yeah.
I haven't like I've never really hurt myself like this.
Yeah.
And,
This is all kind of a new
yeah,
situation.
and
Yeah.
and I'm not like I've never really had a surgery like that, so
I feel like, you would be glad that you did it,
get it.
even if it's
Yeah.
hard, because, and we're happy to speak with your parents,
Mhm.
with your doctor, whatever, and then you can talk with them again to see if they're comfortable with it. But, it'd be one thing if it was your left hand, and that's,
Mhm.
but the risk of infection, it can travel in your bloodstream, and really, you could get really sick and go into shock.
yeah.
So,
I have a kind of a dumb question.
yeah.
So
Any question is
when
not dumb.
when they do surgery, like, do they have like cameras inside the surgery room to like make sure that everything is like ethical? Like,
Oh yeah, they have
Okay.
tons of people observing.
but like,
they-
do they have like actual like cameras?
Let me find out if
Okay.
they have cameras in there.
I know it sounds like a silly
No,
question.
no,
I just like
no.
I've
But-
seen too many Lifetime shows.
Yeah, that they do, those shows do scare
Yeah.
you. No, but this is like a super ethical.
Not saying that you guys aren't, but like just like
no.
it's definitely like something that you think
I
of.
want you to express yourself
Yeah.
in any questions you have. But it is true that they follow a very strict ethical
Okay.
protocol. And then they double check, triple check, and there's tons of people checking that person and checking that. So it's all very tightly regulated.
Because one of the nurses like wasn't very like friendly, and she was
That's
like,
the ER.
and she was like, "You're gonna like lose your arm." Like she wasn't very like nice about it. It was like
Yeah,
very like
yeah.
smug.
Well, there's a lot of ER nurses because they have to like come in and get control of the
Right.
situation. They have that personality, a lot of them. So it's not a personal thing
Yeah.
about you, okay? But we really do care about you. You're very young, and your arm, and making sure that it's okay.
Yeah.
And this is like the thing where time is really of the essence, you
Yeah.
know.
I-
So
I just feel like it's kind of like I don't know. I don't really know very much about like when the surgery is gonna be or anything or just,
they
like
probably do it today.
yeah.
And really, if there's a doctor that you trust or your parents, talk to them, and we're happy to talk with them.
Yeah. I just feel kind of uneasy about being put to sleep.
Really?
Yeah.
Well, you don't want it done when you're awake. I mean, that would hurt. They do it all the time, many times a day, and it's going to be better to get this taken care of and not have to deal with a hand that doesn't work.
Yeah.
And it's unfortunate this happened. I know it's not what you intended, but we just want you to get.
Yeah.
the
No,
care
I
you
definitely
really
want to take
need.
care of it. And
Yeah,
just, like,
it's not fun, but I want you to know that it is good that you're being put. I've been put to sleep many times for surgery,
okay.
and
I
it's
just- I
they
don't know.
make sure that you have anti-anxiety meds in front, so you're just kind of drifting off to sleep. When you wake up, it's over, and so yeah, I understand.
I
that
just don't
you're
have
feeling-
anybody here like that, so it's kind
Do
of.
you have
like,
any family member that can come with you or be here with you?
It would take them time to get here because
Well, how long? I want
they're
to call
far.
them
They're in
and see
San
how long.
Diego.
Do you think they'd come tonight?
Probably, but she's older. I don't want to put her through that stress.
Is it your mom?
That's my grandma.
Your grandma, okay. Is she your main support system?
She's one of them.
Okay. Do you have any sisters or brothers?
My brother's in the military.
Oh, okay. All right. So mainly your grandma?
Yeah, but I'm just like, I don't want to put her through
Yeah.
that stress.
Yeah. Do you want to talk to her?
Yeah, I'll probably call her. I just like,
Okay. All right. Do you want another pillow behind your head to look uncomfortable?
yeah,
Here,
probably.
let me get another pillow.
Thank you.
Hey, can we get another pillow for her?
Anything else?
Do you want 2 pillows or one?
Yeah, probably one for my arm. This
Two.
is kind of
You know,
yeah, I'm just like, I kind of feel like being to sleep.
yeah.
Especially like with nobody like I really know out here.
Yeah, well, we can, they do it every single day.
Yeah.
And it's just,
No, I know.
you know, and it's good. I've been put to sleep many times, you know, it's, if you've never done it, it is scary at first, right?
Yeah, I just,
But I really think that there's nothing to really worry about, you know, in terms of being put to sleep. That you go to the post-op after surgery, you go to the recovery room. They're very experienced in waking people up, making sure they're not in pain, you know, making sure they're comfortable. The nurses are very specialized, and they're used to doing it every single day, you know. So you want to talk to your grandma and think more, and the doctor is happy to talk to your grandma too. And we can help you. We can follow you and see you before and after surgery, and make sure that you are, you know, that
Yeah.
you're doing okay to
yeah,
support you.
I don't know. I'm still thinking about it.
Okay,
I don't
okay.
know.
I don't want you to feel.
But I'm definitely I'm open to talking to the doctor and like,
Okay,
you know, just
okay.
getting his opinion or whatever.
Okay.
Thank you.
So you're a doctor?
Yeah.
Yeah, great. Okay.
Or
all
the
right.
surgeon or whoever,
Yeah, does
like
you wanna
the
talk to
person
the
that knows
surgeon?
the stuff.
Okay. All right. Thank
You
you.
can just like put it here.
Yeah.
All
Let me
right.
just kind of clean it up in here a little bit.
It's really bloody. Sorry.
Oh, yeah.
Did we use the bathroom yet, or?
No, not yet.
No. Psych was in here talking to her.
Thank you.
Perfect. I didn't find any pillows earlier.
No? Do you know where they're at?
Yeah. I think they must have restocked them. There was like maybe there was none in there. I mean, there was just a few blankets.
Oh.
Something like that was all wrapped.
Move that down. Sorry.
Mystery, will you open up that garbage for me really quick?
Sure. Is that already?
I'm gonna use the restroom really quick.
You wanted a handcuff back with you? In the most relaxed position you've ever seen. It looks a lot more intense. There's a giant wad of gauze right there.
Okay.
I was talking to Jake about that. I was like, it's gonna look so silly when I put it on. Again, and he said, don't move the wrist. Keep it where it's at. So you wanted to use the restroom, right?
Yeah. They're still doing fluids. Okay.
Yeah, I'll get that. Here, stay sitting for just a minute.
Okay.
I'm gonna disconnect some things. So we can get you on our commode right here. If I miss something, I'll come back and I'll fill it out. You just make sure that it's gotcha. Level 2 doesn't need help. Yeah. I'm gonna turn the light on.
Okay, that's fine. Yeah.
We can turn it back off.
I was here like 2 weeks ago, and I had gotten pink eye, and
Oh,
I was
yeah.
like, "Turn the light off." Have you ever
Oh,
gotten
gosh,
that?
yeah.
Yeah. It was
Yeah,
awful.
your
It's
eyes
like
are so
super sensitive. Yeah.
Yeah. Okay, I'm gonna lower our bed back down. How are you feeling? I know you had a long talk with our.
I just I don't know. I don't want to I'm like nervous about being put to sleep.
No, I don't blame you. It's kind of a foreign thing when it's not I mean, you've never gotten surgery before,
Yeah.
so it's completely normal to feel.
If you need any help reaching your grandma,
Okay.
let the nurse know.
Will you find out about the dog thing?
Yeah,
If he can,
Oh, the
like,
dog thing, yeah.
before?
I will find out. And then the other thing is, so there's this hand surgeon called Dr. Lee L.I. He's done fellowships in hand surgery. That's all he does.
Mhm.
He's excellent. Actually, he did my husband's carpal tunnel.
L-E-I?
L.I.
Oh.
James Lee L.I.
Could
He's
you
a
write
hand
it down on my
surgeon.
paper?
Yes.
I think I have it. It's right, yeah, this one. You can just
Yeah.
throw it right
Yeah.
there. Yeah.
And so the ER doctor just asked him if he'd be willing to come in and talk with
Yeah,
you,
sure.
okay? And,
And like that way I can like kind of like look for stuff.
yeah.
I like doing my research.
Yeah, he's considered the best one.
Uh-huh.
Okay, so I think you're in good hands.
Thank you.
Okay, all right, so we're gonna just,
Okay.
all right?
I wish I could eat. Food is my medicine.
Might wanna just say, oh, I'm just gonna get this
I was gonna
right.
say right here.
Right here, okay, all right, so, let us know about your
Okay.
grandma,
Alright, thank
okay?
you.
Find out-
Okay.
You didn't know hand surgeons, they're pretty rare.
Yeah.
Pretty hard to come by. At a lot of hospitals, it's incredibly hard to find one that'll take people because they're so rare that they're
Yeah.
already busy, you know?
Uh-huh.
So we're a little bit lucky that we have one here, but sorry, we have so many wires and so many little things.
That might be a faster screw right there.
Yeah, we're
I could just tuck it into my shirt.
Get this guy. It's gonna go on your neck again like we did before. And you don't have to. We already got the urine, so
Cool.
you don't have to worry about. You just wipe however you like. Okay. And this IV is gonna stay connected just while you move over.
Okay.
Should be everything. So when you, I actually am gonna take that off now.
Hmm.
I'm gonna take this sweatshirt.
Oh, okay. No, don't do it. Don't do it. Don't do it. I don't want to do it.
Where is it at?
Yeah, no, don't do it.
Yeah, I'm not sure. What's that? Do you mind if I try just this way?
Is it already cut? Did they cut it?
They didn't cut it, but I think it'll fit around.
It's right here. You can cut it. I don't care.
You okay?
Yeah, cut
Let me
it.
guess, I just don't want that dangling when you're walking around and kind of stuff. Okay.
It's starting to get dingy anyways. We got donuts all over it.
Sorry, we have the most shitty scissors here.
The guy, he was like, I'm gonna cut your shirt. I'm like, why are you gonna cut my shirt from my arm?
I know. We do it to try to slip them off so we can get our gowns on.
Yeah.
But sometimes in emergent situations,
I was like, wait, that doesn't make sense.
Let me grab a few. We have
Alright.
like let's see which ones can work. These ones sound promising.
Sometimes if you do it higher up too, like,
Oh, yeah, these ones are.
yeah, those are sharp.
There we go.
I think once you get it right there, it should be good. Yeah.
Yeah.
Yeah,
Okay.
wait,
you
this
okay
right,
with
yeah.
Put that
It's a
off
bit
now?
tight on the bottom part. Wait, hold on. Oh, that was